What I'm thinking about is that, doing a supervision training really gives you a really good grounding about what you're doing. I think it's not the same as therapy. This is about, whereas I see therapy is very much about, is about someone's personal development. As we work with somebody when we're a therapist, what we're focusing on is their personal development. And whereas supervision is much more about, it has two elements I see. One is about protecting the clients, but I think just as important is about the professional development of the counsellor or psychotherapist. Now, there's an overlap between personal and professional development, but my focus is much more on, how is this going to help you in your work than how is this helping you in your life. Is that making sense? And that's how I would draw the distinction between the two. And I think if we just think it's an extension of therapy, we blur that boundary. I mean, the boundary is blurred to an extent.
Yeah.
However, we blur it even more, and I think that's probably not helpful for our supervisees. Is that making sense as I say that, John?
It is. It makes a lot of sense to me, Mark. Like that really, there can be an overlap, I guess, in those experiences, but there's a real different intention.
Yes.
And I guess a different intention when contracting for supervision and when contracting for therapy.
Absolutely. And I think about, as a transactional analyst, I'm thinking very much about the contract that I have. Have I got a contract here for therapy, or have I got a contract here for supervision? Now, sometimes in supervision, there will be therapeutic material that comes up, and I think that's a really interesting area when we're working in supervision, because I think how do you calibrate what you are doing? Is sort of like there's some therapeutic material that comes up and you're thinking, okay, this is erring into therapy here. However, the question I think as a supervisor you've got to ask yourself is, and how is this a benefit to the client? So not to the supervisee, but to the client. Now, we might use a therapeutic intervention, but I think that is only done if there's a very clear contract around, making explicit, that this might be a piece of personal work, and is this something you would like to do, and how is this benefiting your clients? I think it's an area that you have to tread very carefully in. One of the things that I often do with my supervisees is when I take them on, I check whether they're in therapy themselves, or if they're not in therapy, do they have a place that they can take any personal issues to? Because, I think there's a limit to what you can do in terms of therapeutic interventions in supervision.